I am very excited to have you here, and we have a lot of people on live streaming as well as people sitting here. And what I'd like to do today is to make sure that you know a couple of things. First of all, I will be happy to entertain questions. If the people who are on live streaming, if you have a question or you're having some problems or anything is going on, please email l.bunge, B-U-N-G-E, at holistichealthcareers.com. So the point that we're doing today, and I think thank you for actually being here, and you may actually, everybody may want to take some notes. I thought long and hard, and I thought, you know, one of the things I really want to do is to really orient you to what is the coming up movement in healthcare. And I think that if I can explain to you what is happening currently in corporate wellness, what's happening in healthcare, it's a huge thing. Now, we've been blessed. I am the director of the Institute of Holistic Health Careers. We have also established another part of our business as Corporate Wellness Solutions. We also have a clinical setting with the Center for Integrative Health and Wellness. So we have a three-pronged system, but what seems to be driving a lot of the change in healthcare, with Obamacare, with medicine changing it, fortunately, in many ways, changing its concepts, we are in a whole, I've never seen it before, we are in a whole new upheaval when it comes to wellness, health, healthcare. I mean, it's almost chaotic. It is. There's really difficulties. We have everything from people, you know, the United States is ranked very low in healthcare. We're the highest in money and technology, what we spend on our people, yet we cannot provide healthcare. We don't do wellness care. And you know, and I just want to start out by saying, so you know, that I have 1 foot in and 1 foot out. I was a professor at Ohio State University for about 20 years more probably. I lost count. But basically, what I did is I worked in healthcare. I was in sports medicine, coached and worked in physiology of exercise. But I also taught in medical school. So I know what's happening in medicine, and I think we have to establish that it's not all bad in medicine. What has happened is we as consumers, and I put the responsibility on us, we as consumers have not really taken care and taken charge of our own lifestyles and healthcare. But I also think that medicine has overstepped its boundaries, and I'm very clear when I talk to it. I taught the medical students at Ohio State for almost 20-some years. And I think they're changing. I think it's imploding. I think the costs are driving it completely off the charts. I mean, you ever see what an MRI costs and what the co-pays are? So people that are used to being in healthcare and having insurances, it's all changing now. So what we have done, and I'd say in the past 4 or 5 years, we actually have been doing corporate wellness and working within this for about 10 years now. And I will say that we're very blessed to have partnerships now with several Fortune 500 companies. We're very pleased with working with one of the top wellness programs around in a corporation with Parker Hannafin. Our corporate headquarters are in Cleveland. We are working in several medical centers. We have interns in city hospitals that we're working with. We're working in, so we just had a big meeting with a psychiatric hospital that we're looking at. So I'm going, oh my gosh, after struggling for 20 or 25 years with this all, I'm going, geez, did I just die and go to heaven here or something? But I want to share with you today the details. I really want to focus on things on what are the benchmarks of wellness success in corporations. So I'm going to focus on that. I'm going to talk about what a well-structured corporate wellness center looks like. Now, we could spend 5 hours on what is holistic health, what is wellness, what are preventive health cares. That's a whole big area. And right now, I'll say, we are at the right place at the right time. Never before, and I've seen all of the eras. I started teaching in the mid-'70s at Ohio State. I've seen it grow from the 70s. I've seen the contraction in the 80s. I've watched healthcare and watch it move out and branch out to try to control everything. I've been through the HMO eras, but I've also, on the other end of it, seen the movement in holistic health care, in the energy medicine fields, in the areas of functional medicine. We were doing functional medicine 20 years ago and working with, naturopathic medicine. So all of us who work here have a balance between looking at the medical system and appreciating what they can do and looking at here. Before it was always, a hierarchy. And we were at the low apple here. But I think, and I have to say this, it's been only maybe the past 5 or 6 years where I have seen consumers, it's consumer driven, 79 to 85%, those are the areas that they're saying now, of consumers in the United States are using some sort of complementary therapy, integrative health care, whatever you want to call it, holistic wellness. Now, what I want to shift to, and have been able to shift to, is how we reach America, how we make a change. We have one of the worst healthcare programs, how we deliver it in many ways. That's horrible. You think about it. Your chances, and here's some stats, and I'm going to be doing a lot of stats. Now, I will probably be able to share this with you if you want some written copies of it, because I'm going to give you a lot. You're not going to be able to write it all down, but I'll give it to you. But when we look at our healthcare results and the quality of our healthcare, you have the 4th largest cause of death in our country. I mean, you have the cancers, the heart, but the 4th largest cause of death in this country are medical errors, medical situations, pharmaceutical interactions. They are, it is amazing. The deaths that occurred from the drug Vioxx, which we kind of knew about this as holistic health people. We knew about this in the 80s, the early 80s, mid 80s, when they were bringing the Vioxx out. It was a pain medication. And we started to notice, the cardiovascular issues. And don't ever let anybody say that in holistic healthcare or preventive healthcare or wellness that there's no evidence-based research. That's really not true. I mean, it's so not true that it's not true. So basically, what we started to do is to start to tag this. We kind of have like a green piece with especially the health freedom groups. Especially the holistic health freedom groups. So basically, we started to send the red flags out. Well, they took it off the market, brought it back on, because they said, well, no, they found somebody else to do the research. No. Well, at the very end, they finally took it off the market, where they had actually documented 180,000 deaths off of Vioxx, because it depleted, actually could prove it, and they kept paying. There's no controversy about it. They were paying for that. And basically it depleted the CQ10, and CQ10 is an enzyme that sparks the heart. It's very necessary. You need CQ10. So I'm just giving you that as a concept, kind of setting this era. So why are we in this upheaval now? Well, people are saying, I don't want to do drugs. I pay $1,800 a month for my statins and my pain medications. I had a meeting with a group from the workers' comp. And they are just always, very strict about what they pay and don't pay. And I talked to the gentleman, and he said, we're having a problem. We need to talk to you about a wellness approach. I go, you've always been so hard to deal with. And he says, no. He says, one of the biggest problems they have, they're going bankrupt with pain medication addictions. Running rampant in this country, rampant. And these are drugs that are prescribed by doctors. And they say that basically the pain drug medication addictions, if you took all the street drugs in the whole United States, and to major cities, take them all, I mean, out of cocaine, marijuana, whatever, you multiply it by 100 times, you have the pain drug addiction medications. So within our system, we have created this big elephant, and we don't know what to do with it. And now, the other variable, before I jump into this, so you kind of have the parameters of where we're coming from, because I think it's a new day, and I really get so excited about it that I go, I'll just never retire. I'm just very excited about the whole thing. But basically, we have to really change the culture. We have to change the process. We have to really move the controls into the proper place. One thing I always now say, and it took me a while, but I have been working in many different areas for years. I would go into universities, into medical schools, try to set up integrative medicine centers, and they're happening. Everything's looking good at that point. But still, I always come back to the idea that medicine is not healthcare. Mm-hmm. And people go, if I talk to doctors, I'm feeling very empowered. I've been through this school of hard knocks, and I talked to a whole group of doctors about 7, 8 months ago, and I said, I had a big slide that said medicine is not healthcare. And I'm going to end with this and jump into the corporate stuff, because the reason I say that is if we could really challenge the core problem, which is our perception as consumers that, oh, could we really meditate and change our body so we could cure cancer? Could we really do yoga? Could we really do a plant-based diet? And is diet related to it? You know, we were talking, I was defending psychoneuroimmunology in the 2002, 2003 at a conference where we were debating with medical people. I was asked to speak at a medical conference. And they had and they still don't. They still have a reductionary concept. They have a Newtonian concept, and we're completely past that now. We're into quantum physics. We're into understanding now how, Candace Pert's book, Molecules of Emotion, great book to read, incredible book to read. I was so privileged to be able to sit on some committees with her, and she was at one of our polarity therapy conferences. And her book, she was a biophysicist at George Washington, was unbelievable. And what she's saying is that every emotion you have has proprioceptors, and that what you think and how you deliver those messages to your emotional system affects your physiology, affects the cells, affects the enzymes, so she has proven that. So basically when I say that medicine is not healthcare, and I'd like to really get that concept so that we come in with medicine is not bad. You got critical, chronic care, you have got, if you need a surgery, I don't care what my surgeon knows. I expect him to be a gold medalist or her a gold medalist. I don't care if they know about, this or that, but I want them to allow me to have my yoga person in there. When I'm in the recovery room, I want to be able to have my reflexology, my polarity people, or my Reiki people there, and I want to have that choice of delivering and how I want to have my health care, and I want a complementary approach, and I don't want it to be judged, and I don't want somebody from medicine saying, you can't do that, you can't give them acupuncture or you can't take your kid not doing chemo because we shouldn't, because it's, and try to impose these things. I think we're starting now with the younger, even I see it in many medical people, we're starting to work cooperatively. So that kind of gives you a whole idea, is that we need medicine, but we have to change consumers' thinking, we have to change our whole perception of how we deliver health care. We have to, and we have to really also challenge who does what, where, and when as far as scope of practice. So I think that what I'd like to start out by showing you is to give you some stats. Now, don't be kind of overwhelmed with this, but I just want to talk about how the big thing with corporate wellness. So let's shift to that. The big thing with corporate wellness, and we again have worked with different corporations now. We're talking a lot of times. I'll be referring to single-payer corporations. Those are the Hondas, the Parker Hannifins, the corporations that pay for everything. They're many times the Fortune 500 companies, but 170 million Americans work in single-payer corporations. If we're going to change the culture, now I'm assuming a lot of you are here because you want to get involved with corporate wellness, you want to also understand what's happening in healthcare. I mean, that's just even for yourself. I mean, what are the exchanges coming? What's Obamacare? I think with the situation with Obamacare, and when we do our training as an educational foundation center, a big thing we feel that we have a responsibility for is to educate people on this. I mean, it's going to be a new day. It's a whole new day, because the major parts of Obamacare are saying we need patient-centered care, we need wellness care, we need prevention, we need to work with not just symptoms, we need to really get people into the non-invasive types of things. And it's interesting because all of these variables point to us cooperatively working with the people who are doing chronic and critical care. So there also is so much stats out there, so much statistics that show if you use, and the one that was, I want you to really look this up, because Dr. Nicholas Gonzalez, who is an MD, an oncologist from Sloan Kettering, he pulled away from Sloan Kettering to do 20 years now of a holistic approach to pancreatic cancer. And unbelievable. And his foundational research shows that if you use a multifaceted approach, if you use an integrative approach for any chronic illness, AIDS, pancreatic cancer, all the cancers, you know, critical arthritis, osteoarthritis. If you use a multifaceted approach, you have a 60% plus greater chance of curtailing it and really working on stopping that chronic illness. So one little thing, and so what we have to do, now get that idea, because medicine here says we're going to have, they have a reductionary approach, and they have a whole approach of symptom. Here we are looking at the multifaceted, holistic, integrated approach, mind, body, you know, one thing isn't going to work. And how do you merge these two? Okay, here's my thing. I don't think you do. Okay, and I really will stop at that point, because you can't have your plumber be your financial planner. Okay, you can't have your electrician hire him or her to be your chef. Well, what? So we have to really understand that if I need to have surgery, if I really, my appendix has burst, or I'm in an accident and my finger is almost falling off, I'm not going to sit and drink carrot juice and chant. I might chant as I'm going to the hospital, because I do that. But I think that what we have to do is to understand that we have a whole different thinking here in medicine than we do in wellness care and holistic care. Now that's going to be important for when you start getting into what is corporate wellness, because you can't. I've tried for 20 years. I've tried relentlessly to merge them, and I think we can complement and work together as long as we have a parallel power and responsibility. So that's something that we'll all have to do. Now, let's move into the whole thing with corporate wellness, and I'll say this, is the bottom line is reducing costs. Now, you might say, well, geez, is that all they want? No, that's not all they want. I have been privileged to work with many. We're a partner, like I said, with Parker Hannafin. We're one of their wellness partners. And they always, when I work with them, and our people go in and we work with their factories and their plants, and we hear from their HR people and all of their general managers and whoever's running their systems. They're all different. We hear, we really want our people well. But what's different with corporations, and I see in academia, is they're saying we want our people well, because we don't want them going home with pain. I've heard, you know, I work with Lisa Beck, who's their health coordinator, and I hear her say that all the time. I also hear them even when we're working with Akron and some of the city hospitals. We're working now with a couple other corporations. I'm hearing that, geez, I just hate to have our people not well. But the bottom line for them is cost. For every $1 to $1.25 that they put into a wellness program, now that's your issue. You've got to understand how to implement these wellness programs. They get a return of $4.50, $4.58, $4.60, $4.75. So, Papa John, the CEO of Papa John, when Obamacare came out and started saying, putting in these rules and regulations that you have to have, you know, prevention, you have to work on wellness and so on and so forth. He says, well, I'm just going to stop everything and I'm going to fire 25% of my people, and that's how I can't afford it. I can't afford to do some of these individual things. I can't afford to do this. But see, as corporate wellness coaches or corporate wellness advocates or specialists or holistic health people, you have to get to the corporations because they don't know how to do this. You know, and basically I understand where he's coming from, because they panic, and it's going to be even more. That's why I'm here doing this today. There's going to be more panic when the 2014 comes along and they have to implement some of these things. You know, they're going to have to provide certain things. Then how people are going to, how they're going to deal with the exchanges. There's going to be a point, the old system where you get a copay and you've got all this insurance, that's gone. Okay, because what's going to happen is people are still good. There are some traditional types of things, but people are going to be challenged, because corporations are going to say, some of them, unless we can get to them and help them with this, they're going to say, we're just going to give you some discretionary funds. You do what you want with it. You know, you've got $5,000 if you want to go get x-rays or prevention, that's what you do. So they're going to have the choice of coming to exchanges, health exchanges, and going to different parts. And why cannot we be holistic health exchanges? We are. And that's coming. Okay, so let me start out here. Again, let's focus on some of the things on what is wellness, how do you implement it, and give you some facts, because I think this will be a good place for you to get this information. First of all, let's reduce the healthcare cost. Okay, that's the bottom line. Okay, Now, here's why, okay? The United States spends twice as much on health care per capita, about $7,200, than any other country, and the costs are still rising. I'm just going to give you a progression. In 2005, the national health care expenditures totaled $2 trillion. Okay? From 2000 to 2006, health care premiums increased 87%. The average family health insurance premium was close to $12,000 in 2006. Employees paid an average, a copay, about $2,900. I mean, they haven't been down to the science. So this is what I'm saying when you start looking at this. Hewitt Associates, that's a good company, estimates that health care costs will increase. Ready? Okay, pretend you run a company. You may not want to run one. Okay, but they say that health care costs will increase $28,530 per employee by 2019. Okay? Close to $30,000 per employee. Now, take people like Akron Summa Hospitals, take Honda that we've done some work with, take Parker Hannifin, who has 240 some factories and plants all over the United States, so on, and look at their healthcare costs, say $180 to $190 million. Okay. Now, when you then come at this and say, if we put in basic strategic plans for wellness, which I'm going to show you what was working, and we can save you, if you put just $1.25 here, now that's going to be the issue. How do you get into the corporations, convince them what is wellness, how do you implement it? See, this is the whole thing. They need help, and we need to learn how do you walk in and say to the HR person, let's put it in. But if they would spend $1.25, they would cut costs like crazy. And we'll talk about that because I was fortunate, we've done 2 or 3 studies for different corporations, and the one we did with Parker was over a year. It was in one of their plants in Wisconsin, and it had a very nice culture, very nice group of people. And in a year of putting an on-site wellness clinic in there and doing a whole approach, because there are some variables that I'm going to share with you on what makes a successful wellness program. And if we don't have those key variables, I've seen it in other different things, not just 1 or 2, if we don't have those, they don't work. So we put together a very nice program, and in essence, they saved close to $990,000 in the 10 months that we did the actual case studies. And I'm going to talk to you about data and data gathering, because you can't go, we're not in a social network or in a university or whatever. They're going to say, show me the results, show me the data. And we're the best people to gather that. If you're one-to-one with the employees and you have a system that we can implement, that you're seeing one employee a couple times a month, however that is, you're working with good other partners in this, we have data gathering systems that are simple that show ROIs. So this group put a good program there. We set up the data gathering with our practitioners, and we found that they saved $990,000. They had reversals of surgeries. And so what happened is you say, here's what the data is. And they go, whoa, well, let's get this more. I mean, if you save close to $1 million in one plant, and they have 240 some plants, that's a lot of money saved in a year. I mean, they saved that in 10 months. Okay, that's awesome, yeah. 85% of healthcare, now listen, 85% of healthcare costs are spent on chronic degenerative conditions, including diabetes, obesity, heart disease, lung disease, high blood pressure, cancer, most of which are preventable. Now this is the key. When you talk about a wellness program, you as the wellness director, the coordinator, the partner that you're going to work with in many of the corporations, and I took me 4 years to learn even the terminology and how people, the culture is very different, And again, here we are. I think we have such a separate entity here. We have education, universities, we have even the hospitals are a little bit different. We're finding it a little bit more challenging putting our interns and putting our programs into hospitals, because that's a traditional thing. Right now we have our interns in one of a big Summa hospital program where we're working with palliative care, doing wellness with palliative care and mother-baby. So everything's going to be different. So what happens if you get the core basics, then you're going to have to change this, because one corporation will have, this has happened when we've done a couple of them, 15-minute break in the morning, they work 8 hours, 15-minute break in the morning, 15 minutes in the afternoon, 27 minutes for lunch. So you have to figure out how do you get the program and implement. That's where you come in. And they're really very willing. We're talking to another group that we're working with that does a lot of business machinery. And so they're saying, well, we can't pull people off the plant. Same thing when I've worked with Parker. And same thing in the hospitals, you know, their doctors have to be there. They're all over the place. They can't disturb the process. But, you know, part of this, look at this, 85% of what we could do in keeping people well is all, you know, all these chronic issues are all preventable. But see, what it needs is changing the culture, changing the behavior of people. You know yourself, how many times you said, oh, people are going to quit smoking, oh, I'm going to lose weight, I'm going to do this. And it's called sustaining, and I think that's what I've seen some of the corporations that are moving forward well in this is they're trying to sustain this, not just have, you know, they've been doing this for 50 years, having put a workout room in, detect some diabetes, quit smoking, I'll give you so much money. But I think there's a new way of doing it now, which I'll share. Okay, so part of this too is where is this money coming from with all of this? So you have all these corporations with all these health issues. Okay, the 5-year cost of taking care of a patient, if you're a corporate director, who undergoes bypass surgery is $100,522 for the patients going under angioplasty, I mean for heart bypass, $81,790 for angioplasty. Okay, that's what you're going to pay if you've got 99,000 employees like Parker does. Akron City, you're talking about 8,000 employees type of thing. That's besides the patients. And you have one patient that has a bypass, you're going to be putting out close to $100,000. Okay? Angioplasty, now here's the problem. This is where medicine and where we come in. Why it's a new day for you, because they're now recognizing there. Angioplasty and bypass surgery do not reduce the risk of heart attacks and strokes. Okay, the reason cardiovascular disease is systemic. It's plaque buildup, it's an inflammation, especially inflammation now. It's acidosis in the body. Now, even you, I strongly suggest that you become as educated as you can, because you're going to need these skills even to know what foods. Food is medicine. You went to that functional medicine in California. And basically, we have to learn what we can learn, because we're going to be on the front lines. My suggestion, which the people I've worked with have taken, is we get to the employees. You know, so many corporations do these things, and all the middle management and the senior management do these, but you got to get to the employee who has 5 kids and they're working there. And one of the suggestions I made, which I think Park Panafin, which is a top notch wellness movement program, they put their plants and their clinics they're right there in the plant. So you have 15-minute break, go and watch a 4-minute repetitive motion, exercise, get your, nice cup of coconut water. Well, I don't know if we got that far yet, and then you have a whole different situation there. Okay, here's the other thing. Cardiovascular disease, like I said, is systemic. It's calcified plaque in the arteries close to the heart are not the cause of the most heart attacks, because they're rarely ruptured. It is the thousands of soft, vulnerable plaques located in the blood vessels throughout the body that tend to rupture. Bypass surgery and angioplasty do not address these plaques. And we're just seeing more and more. Patients there was an AVERT, A-V-E-R-T study, you can look that up. It was December of 2010. The patients were randomized to receive Lipitor or angioplasty, and the patients who received only drugs experienced fewer heart attacks. Not that we're just saying drugs work, but it doesn't mean that statins work. But what they're talking about is the fact that they have proven that they just came in and started doing all these angioplasties and stents, put all kinds of stents in the body. Now they're saying, oh, that's not what caused it. Okay. And listen to this. Here's the other variable, because you as a wellness person and as a coach can change a person, and the just simple changing of food, simple stress management, de-stressing the workplace. That's a big part of it. That the cost of statin drugs range from $900 to $1,800. The annual cost of statin drugs is $1,800 per person. So this is just this is one of the things that I'm talking about. So, and again, the annual cost of treating a patient with multiple sclerosis is $20,000 for drugs and $50,000 for total. annual. Okay? According to the Cochrane collaboration, which is a good stats per basis, and you have to know these things. So when you go into the corporations, you have to be able to have this material in front of you and give them, you know, like, it's not me, I'm talking about the Cochrane collaboration, which is a really incredible one on the multiple sclerosis. And it's called Cochrane Database Systems. And they, according to this, medication prescribed to treat multiple sclerosis are ineffective. Within 10 years of diagnosis, over 50% of the patients are walking with assistance, confined to a wheelchair, or dead after receiving the best drug treatment medicine has to offer. Now, we have, in our clinic, we are working with AIDS patients, we're working with MS, and we're working with Parkinson's. And we're finding, yeah, we never, and we work so cooperatively with medicine. And some of these people are understanding it. I work very carefully with a woman whose work gives you a whole idea. That's kind of like, whoa, how much money? Now, can you see why we're having the problem? Any questions? Real quick, anything? Okay. Now, let's move to this.
Excuse me.
Yes,
a question.
please.
So, do the new healthcare policy that's being implemented in 2014, does that have any holistic wellness? You know, does that pay for Reiki or for you know? Are there choices in terms of the, I guess, what we can elect in terms of our health care?
Okay, the question she's asking, which is very good, is within this new change in healthcare, especially as Obamacare has been being organized, is there room for Reiki, holistic healthcare, and so on? And here's the thing. I was blessed to be on a committee where Hillary Clinton, when she was running, had set up a lot of these, her new healthcare program that she was going to introduce. And that went over to Obamacare. Senator McCluskey, who's great, she's the chair of that whole Obamacare thing. She had that, and I was on the CAM part of it. Here's the thing. I think the purpose of Obamacare is, of course, is like a lightning rod. It's upsetting everybody. And there's such a political controversy. I don't even pay any attention to that because I'm looking at the bill. In our training as a corporate wellness coach, we spend 2 full classes, and we're going to actually spend more updating it on have a woman who is a specialist in Obamacare talk to us. Because boy, do we have to understand this. What they're talking about, and this is what I feel strongly because I had some privy with that committee, is the fact that they have set up standards. Now the doors are open. I was saying that yesterday to you. The portals have opened. Maybe the last 5 years even. I haven't seen it. I mean, I've seen it a little bit, but now they're wide open. I look at it almost like esoterically. I see 12 portals. I can actually see this in a meditation, and they're open. And it's kind of like, you know how you see a light streaming through, and you move towards that, or you see that an energy, you go, oh wow, that breeze is coming through. We have the option now of going through those portals, because what Obamacare is saying is prevention, okay? I had a talk with, and I'll tell you this, I had a talk with somebody who is the director of a VA hospital, and she said, do you know, she had lunch, she said, do you know what Obamacare is making you do? I said, what? Well, I have to have patient-centered care, so they have to do a collaborative. So in essence, they're saying no more 2-minute things. You're going to have to at least put patients together and service them and have patient-centered care. So just those 2 words, and I remember those words coming out of Clinton's wording too. And she says, they're making me keep people well. I said, yeah, okay. And she's being honest. She says, plus I have to work to get rid of symptoms. And I have to show that if I'm working on a certain thing, diabetes or Ancient Orange or whatever it is, I have to show a progression that they're getting off of the medications, not just staying on it, band-aiding it. And she looked at me and she says, I can't do this. And she says, I'm a surgeon. She's a brilliant surgeon. She says, I do 10 surgeries a day. She says, my nurses are all over the place. And I said, you know what, I understand. Now, listen to that, because that's their opening, whether you're dealing with corporate America or you're dealing here. And she's a corporation. The VA is a corporation. We're working with them. And basically what they're saying is we can't do this. So Obamacare, Carmen, has opened the door, because I said to her, fine, then what we do is you hire our holistic health professionals, our wellness people, or we set up a system where we can track your people for you. I have a whole PowerPoint on de-stressing the workplace, okay? And this is one of the huge things. 90% of all cancers are stress-induced. 90%, and it can be stress-uninduced. So yes, the door is open, but we have to have credentials. We have to understand, which I'm going to go into next, what makes for a successful wellness program. We have to learn because they don't know. And she said, you're right. She says, we can't do it. Why would a corporation who wants a huge new computer system say, well, we have to do it, say to them, to the corporate people or to the doctors, hey, you get out there and work that computer system. You put it in and so on. They go, what? So you bring partners in. You work with partnerships. But the partnerships with us have to be organized. They have to be validated. They have to be data-driven. They have to be structured so that we understand them. That's where I'm going to go next. So yeah, the doors are open. And here's the other thing. And I told the process of several, like Akron City I'm working with, Parker, some of the other corporations we're looking at, is basically that they're really saying we need to do this, and they don't know, they have no idea. So there are jobs available. I think there are create options, like when we say, we got to have a multifaceted approach. And that's just going to be in the next part of it. Okay, so let's take some notes here, because this is, I want to show you from my own experience and with everything else is what are the benchmarks of what would be a successful. So let's start with looking at what has worked and what is successful. First of all, think about this. The first benchmark is the work site is the ideal place of health and wellness programs. Why? Because employees spend more than half of their waking hours at work. Whew. Right there. And again, I'm talking right now at single payer corporations, because if we can get to 170 million Americans that way, everything is going to start changing. Plus, the single payer corporations can do pretty much what they want to do. They're paying for all their medical insurance. Like with Akron and with a couple other corporations and with Parker, they pay for their traditional insurance, medical insurance, and they have all the benefits. And now Parker is paying for all of the wellness insurance now. They're paying 80% of the there's 20% copays, and they're paying 80% if you want to have vitamins, supplements, detox. They're looking more realistically. It's hard to get into medical areas. You can't put some of they look at, this massage, acupuncture, foods, and meditations, because they don't want to go beyond some of that, and it doesn't work, because if you don't understand detoxing, if you have heavy metals, and that's a key to MS, we can do naturopathic testing. The medicine doesn't understand and want to work with naturopathic testing, and it's brilliant, but corporations do, and a lot of them are doing it. So, number two, wellness programs improve the morale of employees and the quality to work life. That's important. It improves camaraderie, relationships between employer and employees. I have seen that. Walking into the 3 or 4 areas that we're working with, I have watched, and I'm very positive about what we saw when we did that study I told you up in Wisconsin with one of the Parker plants. The HR person was such a champion, and they loved her. Yes, go ahead.
My question is on the corporate level, so they have to pay for the medical insurance piece and they pay for the wellness piece. Are they getting some benefit in terms of savings from the insurance piece so that they can negotiate better insurance?
Well, that's a good question. I think with the single payer insurance, they negotiate all the time. Yes, because if they can get more people off the medicine and put them onto the wellness, then they actually are saving the high cost of drugs. Instead of $100,000 per MS, if they can help them change the, so they don't have to be wheelchair driven and so on, and you keep them with the wellness, it's going to cost you less. It's going to cost you less to have your wellness program, $1.25. So they can, I don't think with the single payers that they negotiate, and it's interesting because we had, in our corporate wellness coaching class, we had a Wayne Miller, who was he was on the Federal Reserve, and he was the healthcare person. And he says that the insurances are going to go they're scurrying. They're absolutely scurrying to keep up with what this, and they're even saying, well, we've got to change. The days of the insurance being carte blanche and dictating are gone. That's the one good thing that's coming out of Obamacare. So that negotiation is like, not so much negotiation with the insurance company. They're saying, oh my gosh, These corporations are putting on meditation groups, stress management groups. You know, you can have a really good program for $1.25 where the medicine is going to cost you $5. That's 4 times the amount of costs. So that's where the negotiation is going to come in, as the proof of it is really going to move to cost-cutting things. Okay, another part of successful wellness programs, they offer, here's the very important for you, they offer a wide, you have to. This is, again, if this is successful, when we do our corporate wellness coaching, as I'm working with many different corporations now, I'm seeing this be true. You're offering a wide range of activities and wellness programs and a holistic approach to their therapies, which means people have more choices. So guess what? One shoe doesn't fit everybody. You don't write a prescription for one thing and you weigh 90 pounds or you weigh 290 pounds, you know. So the diversity of it, so people can look at, and I think Parker's done a good job with this, you know, if you want Reiki, they have Reiki. They have, if you decide, you know, you can use the plant programs they have, but you also can go out and have a Reiki practitioner that you work with, and they'll pay for that. So the point of it, what I find, is getting the knowledge with the corporations so that they know to list a diverse thing, and not to say massage, acupuncture, get some foods, get some detection, and put a gym in. It has to be different. That's why I'm so excited to work with you, because I'm excited to learn myself. Another one is a successful wellness programs offers a complementary program with many different work site-based wellness therapies and options. Something for everybody. Now notice that I said work site, because I think the one thing that I will say that I am pretty set on is that most successful programs have the plant. It's right there. So it's hard because, and I've even worked with this, okay, we have 2 rooms, you can bring your own table in and you have to set up the room. Parker's been able to shift some rooms and make them, but then one of the corporations we went to had only a little room, so we had to help them redesign the room. So it's a fun thing, but you have to be on top of it because they don't know what to do. Now, here's another one. Most successful programs focus on a proactive. This is the best one. Proactive offerings, which I said, of a well-structured and substantial set of interventions. This is intended to provide an infrastructure of health management, okay, activities offered to a large portion of the workforce involved and their families. Now, one thing that I have learned from a couple corporations working with, and Parker does this too, is to engage the family. So, you know, under several insurances that I'm seeing that are offering some of these, they're offering it to their families. So if you are a practitioner or a wellness coach that's working with them, you also can see private clients. So if you have certain specialties, if you're an aromatherapist, they're fine with aromatherapy and paid. Their clients or their employees paid for aromatherapy. They're using it for pain management, lavender for relaxation. Then you start teaching them some stress management, lifestyle skill changes. Okay, so the next one I want to talk about is in what we have seen. So let's say Chris has been with us in different things. Letitia, who you work with, we've got probably about 58 to 60 polarity practitioners in Ohio now that are providers in several corporations. Parker's one, and Wisconsin, Illinois, and North Carolina. We've seen polarity people and other people in Massachusetts area. So here's what we see are the key variables. It has to be on site. Now that's a hard call because hopefully we'll train well enough, our training is well enough to give you how do you do it on site. And that's a hard call. What room, who's going to pay for the table, can I have a little TV set? That's why if you figure out who is your champion, or if you have someone that's really skilled at it and knowledgeable in the corporation. You know, I was lucked out by working with a partner up in Parker, Lisa. I said that because she's knowledgeable and she can say, let me call that person and talk to him. So you have to find the right people. It's kind of a process. Okay, and multifaceted. We already talked about this. Now, what we think is we offer these areas. So you can write this down. When you go in and we work with it, we want to talk about mind-body therapies. That's under the NIH too. Okay. This means that you're talking about reflexology, polarity, craniosacral, Reiki. You're talking about maybe Qigong, Tai Chi. So you have this mind-body therapy. Most corporations don't understand and know how to put in the mind-body therapies as a unit. It's either I'm going to give you some nutritional things or exercises, which are all important too. But you really have to, because where I see the change happening is I have somebody that's working with you. So I'm working with you and you're in the factory, and I see you 2 or 3 times a month. You get a half an hour, a couple times a month. And then I go, hey, how you doing? And and then we're going to show, because we do very specific data gathering information. I'll give you one of these charts that we're using. And whether it's how are you today? After the session, you had a back issue, you were excruciating pain, it was about a 9. Wow, now it's a 5. And we continue to see, so you don't have to do these blind studies. You can do surveys. You can do, pain management assessment. You can do facial expressions. You can see changes, and you can document over a period of time. And I'm going to talk through this because we train our people. We're just putting out new charts, and they'll get feedback, and we'll continue, because I think I am able, if I'm sitting with you, to calculate over 8 to 10 months, you're going to say, hey, Mary Jo, how are you? Hey, I did those B vitamins, I did that meditation you gave me, I did some exercises, and you showed me how to do my own pressure point for the carpal tunnel, because you were doing all the polarity and active pressure on me. So this is what it has to be. If we don't get that on site, and you have to use the mind-body approach with that. Also, the second one is the de-stressing the workplace. So I'm giving you what I know works and the variables that if we don't have all of these together, it doesn't work. You have to have the mind-body, you have to have it on site, mind-body, the stress, and the next one is the biological therapies, which are herbals, homeopathy, aromatherapies, Bach flowers. They work. They're non-invasive, they're inexpensive, and I'll tell you, the most profound study that has come out was with the cancer drug nausea medications. Peppermint oil, I went through a 5-year study. Peppermint oil is as effective as any cancer drug for nausea, from chemonausea. So corporations are saying, fine, it costs me what? $18 for a whole thing of aromatherapy for the chemo drug medication. I checked them. $2,822 for the medications for nausea. Easily. Okay. Okay, the other thing is, I think the whole area of supplements. But again, you have to be key with that. There's many partners that I see corporations bringing in with Metagenics, with very different things. There's a wonderful corporation in California called Vitali, and they're working with partners with different corporations to it. And I think they have a whole different perspective on things. So you don't have to do anything. If you are there and you're doing the mind-body therapies and the stress therapies, you will probably, and you should suggest to people, how about your partners? What do you do with partners? So naturopathic screening, I think this is the tip of the iceberg. It's the best kept secret. Because naturopathic screening, we work with Dr. Kathleen Jones, and every area we work in, there's a naturopath that we work with. And they do hair analysis, they do neurotransmitters, they do hormone testing at the very level. Their blood testing is like 5 times longer. Instead of just 2 or 3 liver enzymes, they do all the liver enzymes. So we start picking up things at the pattern where it's a progressive pattern that's a problem. Also, health screening. A lot of them are doing this, and that's still good. You don't throw one out for the other. Health screening for detection, diabetes, arthritis, structural work, back issues, nutritional interventions, food as medicine. That's where a lot of other partners are coming in. So a good stable corporation is going to say, let me look at a variety of partners. And I'm going to show you within the corporation what you need to have. And then, of course, exercise. There's no way to get around losing weight, exercise, areas of prevention. Then the next area is, I think, detoxing, weight loss. With the naturopathic things, they will also find certain metals that your body's holding. Now, they know, and working with Dr. Jones, we have found all of our MS clients have high off-the-wall charts levels of mercury.
Interesting.
So, even checking out with doctors, specialists in MS, I said, do you know? They said, oh yeah, we know there's a correlation between mercury and MS. I go, what do you think, you can cleanse it? They go, cleanse it? So if we start seeing high levels of mercury, I mean, we don't diagnose. We can do our whole system here, but we can start to work on doing certain chelation and things to get rid of that mercury. It's just not good anyhow. So we find this out 15 years or 20 years before something occurs and manifests at the physical level. But corporations and people who are wellness people that I work with are pretty sharp and they understand this. Okay, so lifestyle skills, you have to make it palatable for the employees, and you got to change their lifestyle skills and their self-help techniques. This is where I think is what's happening. I think that the actual mind-body practitioners, and I like to call us that, energy mind-body practitioners. I think when we're on site, we have a golden opportunity to find out what different other corporations, other partners are doing, and if they're the detection, you work with MedStat. Parker works with MedStat. They work with Vitali. They work with other partners. They put together a wonderful thing, and you can work with them and saying, what do you detect? What's the culture here? Do we have more repetitive motions here? Are we seeing high levels of diabetes in this particular factory? So your knowledge of all that will help you in your area if you're going to be the mind-body person or the wellness coordinator. Okay, here's some other things. What does an actual, let me tell you, this is something we will go in depth and teach you how to do, but what's the structure, what's the process of this within the corporation? Okay, here, number one, I'll just quickly go over this. This is a whole course, which we do. Number one, capturing the senior level support. And I'll tell you, that's a hard one. We are just today graduating 40 people who graduated from our corporate wellness coaching class, and we have some really sharp people that are working in California, Colorado, New Mexico, New York, New Jersey, and they're starting to look at not just, it's good that we're blessed to have the Cadillac of them all and working with like some of the 2 or 3 of the areas we're working with and the Parkers, because they have that senior level. The CEO at Parker is driven, and the board has driven this type of thing because they understand it. So they're a little bit ahead. So we're blessed to have learned this. But you have to, let's say you walk in and hey, what about a medium-sized, small corporations you want to work with? You have to get the senior level support. That's your CEO, your VPs, and so on. Then you got to create cohesive, and then also there's a whole other level of senior level and then middle management, which are HR people. Okay, you got to also find the champion there. The one person that we finally found one of the corporations we're working with. We finally worked hard, couldn't get a hold of this person, couldn't get a hold of that person, so on. Then we found the champion. And she was like, whoa, got the answers, got this, got the timings that we want to come in for our seminars, and so on and so forth. Okay, the second one is you have to and I tell this to the people, if I work with the senior people, then the middle management, you should get that HR person that'll work with you. And there's all kinds of rules around the HR that you have to learn. But create cohesive wellness teams. I suggest this to them. Some of them have it already. The ones that I've suggested we work with now have put together wellness teams. As a matter of fact, I have gone to the senior people and talked to make proposals. And here, and Chris, you've been with me. First thing they say to us is what? Show me the data.
Show me your matrix.
Show me your matrix.
What are your numbers? They have 45 minutes. You've got to give them your spiel. They've factored you into their day, and they want to know your progress. They want to know your success. They want to know what the difference it will make for their bottom line, so that they can go present it to their board, especially if they're public owned. Self-insured is a little easier because they can make their own decisions, but it's quite a process for them. So you really have to have your program tailored and know what it is that they want to hear from you for it to have an impact, for them to then go forward and want to have you back to start implementation.
And that was one of the first things that when we did a couple presentations of different, they say, show me the data, and we'll go ahead with this. What are the results? What can, or they say it nicely, what can we expect from the results, right?
Yes. Well, you may not have that. You may want to walk in with, if it's your initial presentation, you're not going to have any data specific to their corporation, but you're going to want to walk in with these statistics. Spending $1, saving $4. What costs are expected to increase to. Basics like that, especially if they're brand new to this. We had done a study on one of their specific locations in Wisconsin that had the tremendous result of the close to $1 million savings in less than a year. So we were able to show them that this happened in your company at this location in an 8 to 9 month period. We saved X amount of dollars. So, but that took several years of getting into that point, and then the year of the pilot study to then have that tool to go back to them with. So it will take a little bit of time. And you don't always have to focus on a huge corporation. I think there are smaller companies. Everybody, as you were saying, with Obamacare is going to have to provide this next year. So you want to go to them with, we want to help you save money in being able, we want you to be able to provide what you're going to have to provide to your people, but we want to help you reduce your costs in doing that. And really it's not, it's prevention. We're helping them prevent the medical care that would be needed. So it's really pushing prevention, which the Obamacare has brought full circle, which is what you were saying earlier, which the crucial thing of that is that because of the rising costs, people are now, the consumer is starting to focus on prevention because people are just not able to afford treatment. They have to focus on prevention.
So once you go through what she's talking about too, you capture the senior, you get into the middle management that's going to help you where you then create your cohesive wellness teams, and you suggest to them. I always suggest put an employee or two on it, put your group on it. And I like working with the wellness team because they're so excited. Then the other area, the third, is the first thing I always say is let's educate the employees. Now it's interesting because when you work with CAM insurance, which is a whole different thing, and we teach you what all this is, I learned, boy, what a difference is the CAM insurances versus like the Aetna medical insurance. But there are now, there's several things. Avocare is a wonderful corporation that works with all, working with the CAM paying, because you got to go in and say, how are you going to pay for it? They say, how am I going to pay for this? Who's going to organize this? You got to be there with that information. So the first thing I say is let us do some taste of therapies and let's go in and educate the employees on what's wellness care. Let's have a taste of therapies, let's put them in, and I always say, even said to one of the head CEOs that I talked to, I said, you know, I've been talking to a lot of your plants and corporations, but I go in and maybe 2 or 10% of them know how much they have. They know, oh yeah, we can get a massage paid for. But they don't know that they can get their supplements from you. They don't know that they can get homeopathy. This is incredible. They're going, and here is all this money sitting there, and if you don't get to the employees, and that's what I heard from Karen Agnich, who runs Avocare. I recommend her highly as we're talking here. And NGS is working with several different corporations, and they're ones that work with Parker, is how do you get the people to use it? If you could put all the corporation, get them to say, hey, we're going to go and do this, and then all of a sudden they go, nobody's using this. We've had it here for 5 years. So we are educators, and we do the best we can do to get in and educate the employees. I want to see the employees nose to nose. Hey, how are you doing? You got how many back pains? What's going on? And then give them a taste of what the different other things are. Okay, you also have to develop some specific partnerships to provide wellness services. You can't do it alone. So what I always suggest is to make sure that you suggest to the people, we'll teach you how to do this, is to work with partners. You may have one niche in there, but you gotta really value the corporations like Vitale, like MedStats that works on detection. And once you see, if you can coach the corporation to find good partners in the areas of specializations and bring those partners to them, back off when they, they're back into your area, and you work cooperatively. That's hard to put that all together because people are distances and so on, and you have to work at that. Okay, the other thing is, what do I see? Collecting data to drive a results-oriented wellness initiative. Write that down. You've got to have data to drive a good results-oriented wellness initiative, okay? And again, I'll bring this in here. I think the easiest way for you to do it as a mind-body focus and a stress-focused group, that maybe those are your 2 areas. As far as a partnership, you're going to create that. And then you also have the ability to be the wellness director and coach. Yes?
So, Rachel, I'm curious, in terms of collecting the data. So
right.
Is collecting the data done in an interview, in person, or are there follow-up surveys with employees? How is that data collected, and then how is it interpreted?
Excellent. Okay, and basically, I'm gonna pass these out and hand you one of these. This, did you hear her question was, how do we, and you have to help corporations because they don't know how to do it. We did the data collection. Valerie Castleman and I kind of were their partners at that point, and we collected some of the data as a result of our, you know, our goals and so on. So you're right, it's all the above. First of all, we're doing this for another couple corporations, and we have one that's working with patients in a hospital setting. How do you get data from palliative care when they're in hospice? But we have experts, and I'm fortunate to have statisticians and things. So first of all, one of your best is a survey. Okay, you got to collect general data. You know, and you got to make it simple because you can't analyze somebody that has so many complexities, but you can say, after the session, did you feel, were you emotionally felt better? Do you feel calmer? That's something specific. Would you recommend this service to others? So there's certain things. Now there's a pain chart here. I don't know if you can zoom in on this a little bit. There's a pain chart here, but it has to be, notice up here I have primary complaint and secondary complaint. In our HHA program, we go over the difference between primary, secondary, and prevention. We have a manual that we have all these listed, like if you have this condition, what holistic service would you use for the primary thing, the secondary, and the prevention. So you have to educate yourself to know what that. So if my primary complaint is back injury, back pain. The second is migraines. Okay, when I come down here, it says please rate how you feel before the session and after the session with the primary complaint. So you can't lump up a bunch of things together. Okay, then here, so we have a survey, yes, no, because we could say out of 250 patients that we did at Akron, the hospital, we saw 250 over the 4-month period. And every practitioner will fill these out the same. And we found that 82% of all those 250 people had a emotional and calming response. Experience. And you say response, boom. That, you know, now people say, oh, we have to do blind studies, we have to have this kind of group and that kind of group. You can get into, you can figure out after you get this general things. This is what corporations want to see. Over a period of a year, that 82% of your people had stress reduction, and we found that in calming. Their pain on their back, their primary complaint, pain went from 9.8 down to stabilizing between 2 and 3. That's a figure. That's a figure. Okay? So basically what you're doing is you're showing stats. Over here we have a summary notes. Okay? We have blood pressure before, pulse before. We can take a basic pulse. You can hold it. We teach on our polarity therapy. We teach assessment. We can look at eyes. We teach you how to look at the body. When you hold it, what's this versus this? The facial. We have facial expression. So you go. Someone goes, oh, my back, and you get on your feet. You do certain things. You do something, and you're going. So just by you saying at the end of one session, the truth of it, at the end of the reflexology session, the body, the rigidity in the hands, and the rigidity in the face was better. So what happens is we have tried to put this together. I actually have had 5 or 6 specialists look at this, and we're continuing to change this as we go. Because I can then say, like we did at Mawson, we had a pretty good one here. This is a little more detailed now that we learned from that one. But we could say that we had actual out of the, say we did a pilot, out of 30 people over 4 months, we had a 68% reduction in pain in these repetitive motion things. Just a reduction. Now, if I'm a corporate person, I say, okay, you saw 200 clients here. You had, what I'm seeing is they have stress reduction, body relaxation, you have pain management, and at Boston, they reversed 5 surgeries that were induced where doctor said you have to have a surgery, and doctor said you don't have to have a surgery. Now, did we cause that? So we're not talking about it. You can't make causal relationships with surveys or case studies, but these are powerful. You know, the therapeutic touch people who work with Doris Krieger, unbelievable. A PhD from NYU who does therapeutic touch. She went through basic chakra balancing with over 7, 8, 10,000 preemies that were in the tents. And every time they went in and did this certain protocol, the blood pressure and the heartbeat went back to normal. So what do you imagine if someone came to you and said, when we did this particular protocol, 6,000, we had an 89% decrease in the blood pressure going to normal and the pulse going to normal every time we did this. Well, then keep doing it. So what I say to you, and we'll teach you this, right now I'm working with our people who are already in some of our corporations we're working with, and I want them to, so you do it, the best person to do it is the mind-body person who's sitting there. Now, I think there's other things. I think Parker's looking at other things, like if you do certain supplements, if you have a 3-week program, what were the goals and the objectives of that program, and how many people reached that in the 4-week. So you at least have a pilot program that shows you what you've done. So simple, but you have to be, you know, the devil's in the details.
Yes.
And this and nothing else. You don't blow it out of proportion. You just say the stats. You know, within 8 months, we have seen, and we see this person twice a month regularly, have seen that person for 8 months. We saw 150 people like that. If you take all the sessions we've done, every single one, we had almost a 90% consistent, complete decrease in pain and at this level. And then we have here, which is another thing I want to, if you're doing this and you're listening to this, if we have a whole thing here is patients' comments. And I say, please be specific. And so we had, when we presented the Mawson study, we had about a whole couple pages where we said, patients said this about these studies. Number one, I have never been able to have more mobility in my shoulder. I haven't had that since I was 10. Right. Or my finger it ached every single day, and now I don't have that ache. Sometimes if I overuse it at night, I have it, but I don't have that ache consistently. So we then say, here are their comments. But we show them the actual stats, so you see, you get this idea. Now this is one I think we've been through 2 or 3 of this. We're using this right now with all of our practitioners, and we're using it in where we're doing some of our interning with Akron Hospital. And they're actually talking, you know, and of course the palliative care, they can't do much of this. Okay, so basically, let me finish this real quickly, and then we can answer some questions. So you have to after you collect the data, you have to craft an annual operating plan. Now, even if you're one partner, you still should plan your operating. If we still have the same people up in the Wisconsin plant, the same polarity people that are working, and now they're doing, there's some seminars. So some of you say, well, once I get in, do I have jobs? Yes. You know, if you work it out too, with 2 or 3 of the corporations we're working with, one Parker in particular, the employee pays a 20% copay. So if you're getting, say, $55 for a half an hour, you're within that factory, you're seeing, say, maybe 5 or 6, 8, 10 people throughout a day for 1 day. Even if it's 1 day a month, you get a copay handed to you that you have when you're working with the CAM insurances, that you put in your sheet and you electronically, right, when physicians are doing that, and then you get paid from their insurance. So you want to try to help them set up maybe something like work with AdvoCare, and she speaks on our calls. NGS, I find, are very nice people to work with. They have a couple. I think they work with Ohio State too. Okay, create an annual operating plan. Also create a supportive health promoting environment. Changing the culture is what needs to be done. The other thing is you have to choose the appropriate interventions. It has to be multifaceted and on site so you can help them. You know, people say, okay, we'll do it. We'll get all our licensed massage people in. Well, they're good, and we work with them, they're wonderful, but you have people who can be specific. For reflexology people, if someone is, when we're working now at Akron with palliative care, we can get down on the feet, do some things. Cranial, we can go under and just hold even the pulses in the ankles. So I know for a fact, and I'm telling you, I'm not even biased on this, well, maybe a little, but I do believe that the areas like polarity therapy, the stress management programs, and so on. Now, and then again, you have to evaluate the program outcomes. Okay, now, let me just talk real quickly about this, finish the data real quick. I just have a little bit more to go. We're doing fine. Okay, so hang on, just a little bit more. I just want to clarify the types of data that I think are key. First of all, you've got to know the organization's demographics, the plant specifics. When I went through a couple plants, I watched one plant was doing this. Here's what the guy did, and I went in one cell all day long. You can pull this big thing here, you go. I said, I sat there and it was a good awakening to me. I went, I blessed my life.
Absolutely. Right.
And you know what really hit me hard? I mean, I came from a working class family. My dad was a carpenter, my mother was a secretary, and she was a factory worker for a while. And basically, I never appreciated, you know, everything that think about it, 170 million Americans working in single payer. Everything that is you're sitting on, that you're picking up, is made in this, that is made through this kind of factory. There are chairs and everything. We don't get it.
And everything we wear.
And everything we wear.
On our feet, our heads, everything on our bodies.
We use daily.
We use daily, cars. Now, it took me a long time, because so in my academic head, I'm done. We're done. We've got to come into middle America. This is what Obamacare is saying. If you look at even Obamacare, we've actually applied for a couple grants. We'll teach you about that too. They put in grants for community programs, not just medical. They say they want community programs that are making a difference. We applied for one of the grants. We didn't get it, but there's plenty of things there that are showing us that we are going to be very functional in this next movement. Okay? So the other thing is you have to, the demographics, you have to have the information about medical claims analysis. Like one up in the Wisconsin plant, there were a decrease in workers' comp claims during the time that we did it. Now, can we say that caused it? No, but we could sure show the stats that during this time we had saved 990,000 in medical claims. There's certain processes of that, and that basically there's no medical claims, workers' comp, which allows the program to pinpoint the amount of preventable health care dollars the corporation is spending annually. Okay. The other one is the corporate health culture audit, which determines the health norms and the values. What's the culture? That could be how many, for example, when they first started in the Wisconsin one, they had a high percentage, 80% participation. I developed a repetitive motion video, 6 minutes for 4 areas, and they had people that she changed the culture where she had a leader of the employees that would come on before, and for 6 minutes they would do this as they had a leader doing it. So you start seeing the behavioral changes. Okay, then the examination of employee productivity. The absenteeism is a good one, and reversal of conditions. Okay. Okay. Last thing here that I really want to go over is yes. Go ahead.
In
Question.
this case, the baseline data would be critical, isn't it? Because
Amen. Your question was baseline data. This is why you really need to have your ducks in order. People are trying to knock on doors and just say, "Oh, I want to come in and help you." And there's so much failure around this, because even with the corporations, they've got, it takes 3 or 4 months of talking, whether it's Akron or several of the corporations we're working with, 3 or 4 months to even talk to them, have meetings, show them some of these things before we can ever get in the door. But the first thing I say is, what are the baselines? What is your absenteeism? What are your conditions that you're working with? That's why I say the demographics. That's what I mean there. That's a good point you're making. Thank you.
Parker actually provided us with quarterly of the prior year, with the breakdown of the absenteeism and the workers' comp claims and things like that. So when you did your milestone study, we were able to compare that quarter of, 2011 from 2010, so that you could
I think big corporations definitely probably do that. I'm just thinking the mid-size,
Very good points.
That's smaller.
Oh, I'm so excited. Yeah, she's right. What's your first name?
Vandana.
Vandana. Vandana's point is well taken, because you have to be the person as a wellness. You'll be surprised as a corporate wellness coach. You may not know all of the infrastructure, but you have to ask these questions. So that's hopefully we can educate everybody on that. And that's the biggest thing is you go into even a small. We're working right now with talking to a couple mid-sized companies, and we're saying, well, what's your stats? And, well, I don't know. Well, then let's get them started. So even if they can give you some information for the first 4 months that you're trying, it will take you 4 to 6 months to negotiate with them, get the wellness teams put together, get the HR person, find out what, and I think we have broken our stuff down into 3 phases. Number 1, information education. What is wellness? What are all the stats stuff? Then the second thing is, let's work together with your team. Let's create your wellness team. Let's talk to them. What do you need? Go through the plans, so on and so forth. Then you can start simple with the simple programs. This is a wonderful system. I love it. It's very exciting. Let me finish real quick. This will just end this real quick here. But you need the concrete information in front of each of your corporate wellness team members. So you should do some of this first. It takes training, resources, and significant commitment to collect all this type of data. Just like I said, you will be able, here's what you're talking about. If you get this information, you will be able to create a data dashboard that can be monitored longitudinally over time. You have to look at this longitudinally. Like we need to repeat that study up from Wisconsin and we're trying to do that. And you can be the one, because you have to lead it. You know, every person that's going to be in our team, and any of you that hopefully go through this and train, we're going to give you whatever you need and say, when you first walk in, let's start collecting this. Even if it's just, how did you feel today? You were working with me, you had severe knee pain, it was a 9, you get up, how was that session for you? Now, relate that back to their 9, you say, oh my God, I can move it. That's about a 4. And you just keep repeating. If it's that simple, then you have something to judge by, okay? You will be able to create this data dashboard. Data collection may vary and will be the most important benchmark in the entire wellness workforce process. It creates a result-oriented wellness program. It's not going to work. You're not dealing with your esotericness and feeling good and how this is going and that's going. You have to say, you know what? After 3 months, we have shown this. We had 18 back things that were now, they have 60% more mobility. Because you can get data off of this. Once we put all these forms together, they're out at our people are out at a couple different places, and I said, bring these back at the end of every month, and then we're going to have our statisticians start putting the percentages down. Very simple. We say, okay, yes. They say, were you calmer? 80% of the 250 said yes. So we had 82% response of 250 sessions that we gave that said they were calmer. Okay. Last thing now. Okay, and then we're almost done. Okay. I want to talk about results, and I can give you, I'll tell you, we have people, again, graduating with our corporate wellness, and the biggest thing I heard them say was, oh my God, the material we got. I said, well, organize it, because it changes all the time, and we will give you certain key things. And I have actually, before we get off of this, I'll give you 2 or 3 areas that you should look at. First of all, a review, this is what I've pulled, a review of 32 studies, okay, of corporate wellness programs found claims costs were reduced by 28%, physicians' visits declined by 17%, hospital admissions declined by 62.5%, disability costs were reduced by 35.4%, and incidence of injuries declined by 24.8%. Now, if you were the owner of that company, what would you say?
Sign me up.
Sign me up. I know. Same thing. Sign me up.
And this is what Chris was saying. So this is not, rocket science, but it's managed detail. And if you are off the wall and you're running here, running there, doing this, doing that, you're not going to be able to do it. You have to be thought-driven. You have to be organized. And it's not difficult. I will teach you. Okay? A study reported an average, and I have all the stats. I have all the references and all the stats, everything. A study reported an average annual savings of $8.5 million during 4 years when 18,331 Johnson & Johnson employees participated in a health and wellness program at work.
Wow.
A separate study of the same group showed a reduction in tobacco use, sedentary lifestyles, high blood pressure, high cholesterol, low dietary fiber intake, and poor motor vehicle safety practices, stress reduction, a lower incidence of absenteeism, and more mobility. Now, if you can do that and you can say, you know, I've been in your little business and we did a pilot, do a pilot for them. And basically you can show that. Okay, another study showed that employees who utilize an employee fitness center gained both physical and psychological benefit. They improved morale, 64%. Now, how would you test that? You would say to them, you would do your surveys. Okay, now that you're doing your exercise, we have this gym, and you had your body work, and now you have this gym. You know, how is your emotional well-being? You ask something specific, they say, oh my God, I haven't complained for 2. I feel yes. You get them to say, yes, I do. Okay, Citibank. Now, interesting. One of my first experiences a while back with all of this was years ago with Bank One. I spent 2 years with them collecting data and working on they were so far ahead of the game. That was my first experience with it. And actually we're going back to a couple banks have called and we're looking at this. But the Citibank's health management program reported an estimated return on investment, ready, of $4.56 to $4.43 saved per dollar spent on the wellness program. That's AJH and Gazaki et al. That's the report, the survey. I'll give you, we have this, when you take it, we have all of these, the stats and wherever. Over 5 years, Blue Cross Blue Shield of Indiana realized a 250% return, 250% return on its corporate wellness program investment, yielding an ROI of $2.51 for every dollar invested. That was March and April of 2002. Now, some of these references are under, I'll give you this. Aurora Healthcare, 205. You can just go Aurora Healthcare. We have actually put in tons and tons and tons of information. Now, you have to know, and I'm going to summarize here very quickly. You have to know that right now the gross national product, okay, especially the gross domestic product, which means the government shows you their trillions of dollars, to show you a big pie. And anything past 2 or 3% of that big pie is huge. Of what expenditures are. Our gross national, our gross domestic product, 20% of that pie is outrageous healthcare costs. This country is going to go bankrupt with healthcare costs. This country is in great need and is, and I don't care what anybody says about what's happening, and everyone's mad and everyone's fighting and so on and so forth. I know it's chaos, but we're at the right place at the right time. If we do not change this gross domestic product percentage that we're spending, my friends, we're going down the tube. And corporations are going to be shutting their doors. Yes, it's wonderful, the single payers and the the multi-trillion dollars, $18 billion corporations, but they still, I sit in some of their meetings and they are detailed, like they are like one little slight percentage different in their stock, and boy, they're on it. So you have to really get involved with that. Now, there's a couple of references, and then I'll answer a few questions, but one of the references I have that we use in our corporate wellness coaching is health risks and their impact on medical costs, and that's from Milliman and Robertson, Inc. That's a wonderful stat thing. There's another one from the Institute for Healthcare Improvement, and that's called Increasing Efficiency and Enhancing Value in Healthcare, and that's how to achieve savings in operating costs. Now, we have 50 of these that we work with. And the last one that I think that I got a lot of my things is called the Brave Well Collaborative. The Brave Well Collaborative Report on the efficiency and cost effectiveness of integrative healthcare. So these are things that I think are important to you. How about a couple questions before we go? Yes?
I didn't want to know what the compensation is.
Okay, compensation. The compensation has various dimensions to it. Most of the time, if you get an active corporation, which I think we'll see, I think we'll see the corporations like Parker, Honda, we're actually talking to them. We'll see Standard Oil, and Finley is looking at some things. Basically, you'll see these corporations, and they will say, they want to know, what do you charge? When we worked with wonderful Lisa and Parker, they said, well, what does a polarity practitioner make? So you could be probably instrumental in saying that. What they'll do is they'll probably do, most single payers will probably put you out as providers. Now, maybe some of them will hire wellness consultants for a salary. That could be, or consulting fee, and we teach you what goes in different areas. But Parker will pay, they have a big sheet that says for a half-hour polarity session, it's $55. For an hour, it's $75. Okay? And basically, you get, and then they'll say, the employee will pay 20%. So if they want a half an hour polarity Reiki or foot reflexology, and let's say you're there doing Tuesdays and Thursdays twice a month, you say 10 clients, then you will make $555. But you will get a copay, and then you do the paperwork, and you put that in. So you would have to have them. Do they have? This is where you have to start the education. So some of this, and I will say that some of this has to be a labor of love, because as a business person, you have to learn. You have to walk in. Here's my PowerPoint on my stress reduction PowerPoint. Okay, and I can show them, all my PowerPoints. I can show them, all my slideshows. I can do a little presentation. So are you organized? So once you go in, you have to get your materials together. So you walk in. So it's good to have a collaborative. I love it, because we're starting to see in our school, as we produce these, that's our whole gig, is educating it, is that we're seeing people come together as partnerships. And so you go in with 2 or 3 people, and who's doing what. So the compensations are usually a flat fee for your services. There could be, like if you go in and do like we've done brown bags or seminars. We're working with a law firm right now. We're looking at that, and we're doing some. We've gone in before. We've done 2 of them. We've gone in and done a brown bag, and they say, okay, we'll pay you a flat $300 for your services. So this is something that we're putting together, and we're morphing it. So we're happy to train you and show you that type of stuff, and it's a really neat thing.
So you're saying it just kind of depends on what actually is implemented?
As what?
What is implemented, pretty much?
Well, it depends upon what is arranged. Most of the time, you're going to be like a regular insurance. I think what will happen with the single payer, you will be as a provider. It's like a doctor. You choose your doctor in your system, and your doctor goes in, has the fees, and the insurance company says, yes, those fees I accept. So we're going to be just like that, only under the CAM insurance. It's called the CAM PPO, or they may call it Wellness PPO. Avocare is that NGS. So I'm working now. I'm learning. I trained for 4 years with this. I'm learning. But that's a good question, because you want to deal with money up front with corporations. You want to say, you can come in and say, I have level 1. I can do this type of. Maybe you just may be educated. I'm going to do this 101 for you, show you what to do. We have that now listed, and we're going out to do some of these. And we'll say, okay, that's a flat fee. We'll train a 3-hour or half a day, $300, whatever. So you then, we'll have that all the way. Hopefully we're ahead of the game. We are. We're probably a bunch of years ahead of the game on this. So we're already at the stage where we can start putting together proposals. We'll teach you how to do that in the corporate wellness class. Question? Yes, please.
You talked about, could you clarify annual operating plan? I mean, is it for the individual, the corporation? Or?
Okay, that's good. The annual operating plan for me would be, as the wellness coordinator and helping them or being a partner with it, is here is what I am seeing. Here's a pilot, then I can see us implementing this 3 days a week. Then I can see us doing stats here. Let's review it at 12-month stats, at 24-month stats. And I look for 2 or 3 years. Let's look at the sustainability. Why? So often, I look when I did the corporate wellness coaching, we go back and look at, they've been doing wellness programs, P&G, Parker, not Parker, but Procter & Gamble, MD Anderson. They're doing these wellness programs, but they've just been like exercise detection. And they have done good results. Obviously, we have some good results. But what you want to do is to say, here's, let's get the results, but let's make it sustainable. Put your partners together, and what's your plan for the next 2 years to keep this going? So that would be what you, as a corporate wellness coach,
Sustainability of the program.
sustainability of the program.
Once you have it up and running and you leave, it continues, and they continue to have
So it's not just the money operating plan, it's more like long-term
Programming. Yes, and you can, maybe if you do a pilot, you could say, geez, they don't really get this so much, but they love the relaxation response thing of breathing, 10-minute meditation, 10 minutes, 5 minutes, you can do that quickly. And so you then go, I always like to go in and say, let's do some pilots. Give me a chance to, give me 5 months, 6 months, see what results we get. And all you have to do is pay. And then you might say, here, here's what I would charge for, a 3-month pilot to show you. Then, if they want the program, you can say, okay, then let's try it for the next 2 years. And what I'll charge for per year is $700 or $800 per employee. And then here's this thing payable in 3 sections for you to have us implement it. Then you can review it at the end of a year. Good question. Okay, we're going to close now. Thank you for sharing this with us. If you want any information, please, our website is holistichealthcareers.com. We have the Holistic Health Advisors Program is an online program that's a prerequisite to our Corporate Wellness Coaching Program. The Corporate Wellness Coaching Program starts August 1st. It's an interview thing, so we don't take all the people we have, but want people who have. You don't have to necessarily be one thing or another. So if you also just want some help and some information, please email me. I'm at SATNAM, S as in Sam, A as in Apple, T as in Tom, N as in Nancy, A as in Apple, M as in Mary, SATNAM 170 at AOL.com, or go on our website, or you can email or call our centers, 614-299-9438. Our whole purpose is to see this initiative. It's going to be, let me tell you, there's so much out there for everybody. We're going to need you. And you're going to have many opportunities. But you have to learn, educate, and work at it. It's not just going to drop in our laps. But we have it, and at least we have the portals open. Anything you'd like to finish saying, Chris, at the end here?
Just wanted to elaborate a little bit on compensation for you, because I know that's everyone is hoping that they will have employment and they will be able to make a living at this. And I think what we have learned is that it is two-pronged. Initially, you're going to go in and you're going to have your initial meeting. That's going to be on your time and your dime. Then you cannot. We're noticing that you can, as maybe your own, set up your own company, and you create your programs. You maybe go in and educate the population on. A lot of people don't realize, as Mary Jo was saying, what they have available to them through their employer. They don't understand what CAM, complementary alternative medicine modalities are, or therapies are, or how they can assist them with whatever current medical treatment that they're getting. So I like to talk of it as you're going to educate the population. Then you could have your second tier could be, and that could be a lunch and learn. It could be an afternoon of maybe you start with your HR people, and then you go from there. Then you're going to establish the needs of the population. That might be a couple of days where you go in and you assess the entire population. If it's a factory, if it's a IT station, if it's an administrative station, everybody's going to have different needs. And then you're going to engage a program. That could take a week of going in. And all those will be at an established level of what you would charge per hour. So that might be something that you do as your own consulting company. The other prong is once you're implemented, you then become a provider under the NGS or an Advocare system where you would have an hourly rate where you would then help them sustain their program. And what we're learning is that NGS and Advocare and these systems have certain criteria that you have to have for a lifestyle wellness program, where you might have a set time of 3 to 4 months where you need to see results, but they will allow people to engage in these, and they will allow you to come in and consult and run them. That's where you can become a provider. So initially it will be your own company possibly getting in and creating the program, and then once you're in, you can become a provider.
And yes, to end, thank you very much. To end, what we think is working best is what I call a community. Corporate Wellness Solutions is you, is us, is a community. Chris is the executive director, Letitia's one of our administrative people. So, we want to model what we're saying. So we have inclusivity, and people are independent on their own. They can train, they can do it. But then we use a consortium, ours, because with wellness, so we have all these different opinions. We have different people now that we can put in different areas. Like I see, one thing is the polarity people. The polarity are all over the United States, Canada, Europe, and we have a commonality there that I know that if we have a taste of therapies and they're going to do a basic chair session in polarity, they know what to do. So as a wellness coordinator, you find these common groups and we put together a community and a cooperative. That, I think, is the best, instead of you singly trying to go out and do that. So thank you very much, and all of you on the live streaming. Is there any question that came in, Letitia, on that? Please email me if you have a question. I'd be happy to talk to, interview Letitia or Chris. And you just go onto our website, you'll see that, or email me and I'll get you to the right person. Thank you. Have a great day, and onward and upward with wellness.